Okay, so you're thinking about diving into medical coding. Huh. Trying to figure out which program is going to get you where you need to be.
It's a big decision.
It is. And I bet you're realizing that just seeing that accredited stamp isn't enough, right?
Right. There's a lot more to it than that.
Exactly. So many people assume accredited automatically equals good, but that's not always the case.
Not at all.
And that's why we're here. We're going deep on what actually makes a medical coding program worth your time and money. We've got a whole pile of sources to help us break it all down.
Buckle up.
Right. We're talking about really setting yourself up for success with a recognized coding certification, like the CPC or the CCS-P.
Those are the big ones, the ones that are going to open doors.
Exactly. And that's where it gets really interesting. You know, a medical coding program doesn't actually have to be accredited by the Department of Education to get you ready for those certifications.
Nope. And a perfect example of that is AAPC.
Oh, right. AAPC, one of the biggest names in the game.
Exactly. They're one of the top certifying agencies out there, and their own courses and certifications aren't even accredited.
Huh. So it's kind of like accreditation's important, but it's not the be-all, end-all.
More like a baseline, yeah.
Okay, so we need to dig deeper then. One of the sources we've got here talks about this billing and coding trap. What is that?
So you got to watch out for programs that have billing and coding in the name. It sounds good, like you're covering all the bases, but it often means they're not giving you enough focus on just coding.
Wait, so why is that a problem? Aren't billing and coding basically the same thing?
They're definitely related, but when it comes to those certification exams, especially the CTC, they really want you to have a deep understanding of the coding systems.
Okay, so like ICD-10, CCM, CPT, all those fun acronyms.
All of them. You need to know those inside and out. So if the program is splitting its focus between billing processes and all the details of coding, you might not actually get the mastery you need to pass those exams.
So it's almost like you wouldn't go to a cardiologist for a broken bone, right?
Exactly.
You need someone who specializes in the specific thing you need.
Exactly. And that's something to think about before you even start looking at different curriculums.
Oh, okay. So like, what are my coding ambitions?
Exactly. Are you looking to just get that foundational certification? Or are you thinking about going for a double, maybe a dual certification? Figure out what you want, and that'll help you narrow down your program choices.
So if someone is listening to this right now and they're thinking, okay, hold on, what are my coding ambitions? How do they figure that out?
I'd say spend some time thinking about what kind of coding work really gets you excited. Like, do you see yourself in a physician's office working with all those outpatient procedures? Or are you more into that fast-paced hospital world, dealing with those really complex inpatient cases?
Oh, I see. So it's like figuring out what kind of environment you want to be in, what kind of cases you're interested in.
Right. The answer to that will guide you to those specific certifications and then the programs that will get you there.
That makes sense. Now, our source also mentions the CPC, the CCS-P, and the CCS as some of those key certifications. Can you give us a little rundown of what each of those focuses on?
Absolutely. So the CPC, that's the one offered by AAPC, and it's kind of seen as the gold standard for physician-based coding.
Oh, yeah.
It's all about coding those outpatient visits, the procedures, making sure everything is accurate. Then there's the CCS-P, also physician-based, but it goes a bit deeper into all the specific documentation and guidelines for that setting. That one's offered by AHIMA. And then you've got the CCS, also from AHIMA, and that one's all about facility coding, so like hospitals, outpatient surgical centers, that kind of thing. And that one, you're dealing with a whole different set of codes and guidelines.
Okay, so there's a lot of variety out there. I'm seeing the theme here. Know where you want to go before you figure out how to get there.
Exactly. Like you wouldn't take a scooter across the country if you were trying to get to Alaska.
Right.
Gotta have the right tool for the job.
And in this case, the right tool is a program that very clearly states it'll prepare you for that specific certification that lines up with your goals.
Right on.
Okay, so we know we need to be specific about our goals and match our program to that. But let's talk about the actual curriculum itself. What should a really good program actually cover?
So first things first, you've got to have a solid base in medical terminology and anatomy. You're basically learning the language of coding.
I can already feel my brain starting to hurt thinking about all those terms and systems.
It's a lot, but don't worry, you don't have to become like a walking medical dictionary or anything. The important thing is that you understand the terms that are relevant to your coding specialty.
Okay, that makes me feel a little better. So a good program will help you focus on the stuff that matters most.
Exactly.
So what comes after we conquer the terminology?
Then it's on to guideline mastery. This is the real heart of the program. You're learning the rules of the game, how to apply those codes accurately, ethically, based on the rules of each system.
So if medical terminology is the language, this is like the grammar.
Yeah, perfect analogy. You need both to communicate properly.
Makes sense.
And then, the most important part, hands-on practice. You can read all the textbooks, listen to all the lectures, but until you actually start applying those codes to real-world medical situations, you're not truly ready.
It's like trying to learn an instrument just by reading sheet music, right?
Yeah.
You got to pick it up and play.
Exactly. And a good program is going to give you plenty of chances to do just that. Coding exercises, simulations, case studies, things that mimic what it's actually going to be like.
So they're not just teaching you the codes, they're teaching you how to think like a coder.
Couldn't have said it better myself. And that's where having a really well-structured curriculum and experienced instructors comes in. They'll take you beyond just memorization to actual understanding.
So how long should someone expect to spend in a comprehensive program like this?
Well, the source we're looking at says at least 40 weeks for good, solid instruction. Yeah, you're going to be covering medical terminology, the coding systems themselves, and then dedicated time for exam prep.
So that gives you time to build a good foundation and actually practice those skills.
Exactly. But remember, that's just a general guideline. Some programs might be longer, especially if they offer those specialized training tracks or if you're going for a dual certification.
Right. Makes sense. I'm sure there are programs out there that promise to get you certified super fast, but I bet those don't really give you the depth you need.
You're absolutely right. Coding mastery takes time. If you rush through it, you might get a certificate, but you're not going to feel confident handling those tough cases you'll see in the real world.
And I imagine in this field, you don't really want to be learning on the job when it comes to patient info.
Definitely not. This is people's health we're talking about.
Right. So it's like anything else. If you want to be good at it, you got to put in the time and effort.
Exactly. And medical coding, it's a career, not just a job, so you're investing in your future.
Absolutely. Speaking of investment, let's talk about getting ready for that big certification exam. What should a program do to help you ace that test?
It's not enough for a program to just teach you the material they need to get you ready for that exam. A good program is going to make sure you're ready for how intense it is. We're talking mock exams, timed exercises, even giving you specific strategies for the exam.
Yeah, that makes sense. It's one thing to know the codes, but using them quickly and accurately under pressure is a whole other thing.
Exactly. Think of those mock exams like a dress rehearsal. You get used to the way the exam is laid out, how much time you have, and you see the types of questions you'll be facing.
Makes sense.
And those timed exercises. Coding in the real world, it's not exactly a relaxing walk in the park. You have to be fast and accurate.
Right. Time is money.
Exactly. And those exercises, they help you build up that speed and precision you need.
So what about those exam strategies? What do they give you, like a secret decoder ring or something?
Haha. No decoder rings. It's more about understanding how the exam is structured, knowing the common traps people fall into, and how to approach those tricky questions that are designed to throw you off. A good instructor, they'll share their insights and help you come up with a plan to tackle that exam with confidence.
That's super helpful. So we've covered the basics, we've talked about the guidelines, prep for the exam. But the thing about medical coding is it's constantly changing. How does a program keep up with all that?
That's a great question, and it's something a lot of people don't think about. It's not like you just learn it once and you're done.
Yeah.
You have to stay updated on all the guidelines, the code changes. It happens all the time.
Oh, for sure. So how do you do that? Is it like a constant subscription to a medical coding journal?
Haha. There are definitely resources like that, but a good program will bake those updates right into what they're teaching. That way you know you're learning from the most current stuff. It's also really important that they focus on the why behind the codes, not just the codes themselves. If you really get that, it's a lot easier to adapt when things change.
Oh, that makes sense. It's like learning the principles of architecture instead of just memorizing blueprints, right?
Perfect analogy. If you understand the principles, you can adapt to different designs and styles.
Exactly.
A program that goes beyond rote memorization, that's what's going to set you up to be a lifelong learner, which is so important in this field.
Absolutely. Things change all the time. Okay, I'm really starting to see how just having accreditation isn't enough. You've got to make sure the program is staying on top of everything happening in the industry.
Couldn't agree more. And honestly, that's one of the biggest differences between a good program and a mediocre one. A good one will have their finger on the pulse of the industry, making sure their grads are ready for the real world, not just passing an exam.
Love that. So we've talked about the curriculum, how to prep for the exam, and staying up to date. What about support that goes beyond the classroom? Are there any extras a really good program might offer?
Think of it this way. A great program isn't going to just get you to the finish line. It's going to make sure you hit the ground running when you start your new career. This might mean things like having sessions led by instructors where you can get one-on-one help and ask questions.
Oh, that'd be so helpful. Like, it's one thing to learn from a textbook or online, but having that direct interaction with someone who knows their stuff, that's got to be so valuable.
You're telling me. And some programs even offer internships or externships, which give you a taste of real-world coding in a safe environment. You get to apply your skills, build up your confidence, and you start making those professional connections.
Yeah, those sound awesome. I bet those are really competitive.
They can be. But if a program goes out of their way to help you get those opportunities, that shows they're really committed to their students.
For sure. What about job placement? Is that something a good program would help with?
Absolutely. A good program knows that landing that first coding job can be scary. They might have things like workshops for writing your resume, they might help you prep for interviews, or even connect you with employers they have relationships with.
So it's like they're your career coach.
Exactly. And, it all goes back to what we were talking about before. With accreditation not being everything, a lot of these extras, they're not things an accrediting body's going to look at, but they can make a huge difference in your experience and how successful you are in launching your coding career.
So true. Okay, let's talk about the big one, cost. These programs can be a pretty big investment. How should someone figure out the cost versus the actual value they're getting?
You got to be smart about it. Don't just look at the price tag and freak out. Ask yourself, what's included in that? Are your textbooks and study materials covered? Are there extra fees for things like exam prep or the coding software?
Ah, so many hidden costs.
You got it. And don't be afraid to ask about payment plans or if they have any scholarships. A lot of programs try to make it more affordable.
That's good to know. And I guess you have to weigh that cost against what you could be making once you're working.
Exactly. Sometimes a program that's more expensive might actually save you money in the long run if it's more thorough, has better support, and is better at helping you find a job.
It's like investing in a good tool, right? It might cost more upfront, but it'll last longer, work better, and you won't be spending money on repairs all the time.
I like that. It's about investing in your future, not just spending money.
For sure. Okay, before we make that final decision, what's the best way to check out a program's reputation?
You want to go beyond just the marketing stuff they put out there. Look at their pass rates. Do their graduates consistently pass those certification exams?
So high pass rates are a good sign the program is doing a good job.
Definitely.
Yeah.
But don't stop there. Look for testimonials from students, past and present. What are they saying about their experience? Did they feel supported? Did they think the curriculum was good and relevant? Did they find jobs afterwards?
It's like reading online reviews before you buy something or book a hotel. You want to hear from people who've actually been there.
Exactly. And if a program has a good track record, they'll be happy to connect you with alumni who can give you an honest opinion.
That's great advice. Now, earlier we talked about how AAPC doesn't have accredited courses. Are there any other providers that stand out like that? I know our source mentions AMCI.
AMCI, the Absolute Medical Coding Institute, they're known for their focus on guideline mastery and getting you ready for that exam.
So what makes them different?
They don't just teach you the codes, they really try to get you thinking the way a coder thinks. That's so important for adapting to new situations and dealing with those tough cases that come up in the real world.
So it's like they're teaching you to be a coding detective. Not just memorizing codes, but understanding the clues and solving the mystery.
That's a great way to put it. And it's really interesting because AMCI isn't accredited by the Department of Education, but everyone in the industry knows they're good. They've got a great track record of helping students succeed both on the exam and in their careers.
It all comes back to accreditation being just one piece of the puzzle.
Exactly. AMCI shows how a program can build a really strong reputation based on how good their curriculum is, how much experience their instructors have, and how successful their graduates are.
Makes sense. Okay, I'm starting to feel a little overwhelmed with all this info. Where do you even start looking for these programs?
It can feel like a jungle out there. Don't worry, we gotcha. It can be, yeah. But it's not as scary as it seems. A good place to start is just a simple internet search. Type in medical coding programs and then your state or region.
Okay, that makes sense, but then you're probably hit with like a million results.
Oh yeah, for sure. So that's where those professional organizations we talked about come in, AAPC and AHEMA.
Right.
They often have directories of schools or programs on their websites, places they've approved or recognized.
That's a good tip. Because like we said, Even if a program isn't officially accredited, those organizations have their own standards.
Right. It's like a stamp of approval from the coding pros themselves.
Exactly. And don't be afraid to just reach out to programs directly.
Oh, yeah, good point.
Get some info packets, maybe attend an online info session, see if you can talk to some current students or even some alumni.
That's huge.
I feel like hearing from actual students is so valuable.
Oh, absolutely.
It's like getting a restaurant recommendation from a friend. You trust them more than some fancy ad.
For sure. You want the real scoop, the good, the bad, and the ugly.
Exactly. Ask them about the instructors, the support, how the job placement went. That's gold.
Yeah, you're not going to get that from a brochure.
Okay, so you've got your list of potential programs. What's the best way to compare them? Should I be making like a giant pros and cons list?
Pros and cons are good, but honestly, a spreadsheet or a chart is even better.
Oh, I love a good spreadsheet.
Right. It helps you compare everything side by side.
It's like my coding command center.
I like that. So you can look at the curriculum, the cost, what kind of support they offer, and those all-important pass rates.
Right, got to see how their grads are doing on those exams.
Exactly. And remember those key takeaways we talked about?
Okay, so like, does it match my goals? Is there enough hands-on practice?
Yep. What kind of support do they offer after you graduate? Are the instructors good? Are they experienced? Do they actually stay up to date on everything that's changing in the industry?
And don't forget, watch out for that billing and coding in the program name.
Good catch.
Make sure coding is really front and center.
Absolutely. And at the end of the day, trust your gut. This is a big decision. Go with the program that feels right to you, the one that gets you excited about this whole journey.
Okay, I love that advice. So as we wrap up our deep dive here, any final thoughts you want to leave our listeners with?
I just want to emphasize that medical coding, it's a fantastic career. It's challenging, it's rewarding, and things are always changing. So finding the right program, that's what's going to set you up for success. Don't just settle. Find one that'll make you a lifelong learner, a critical thinker, a true coding pro.
That's awesome. So for all of you out there ready to take the plunge, do your research, ask the right questions, and trust your gut. The perfect program is out there for you.
Happy coding, everyone.